The honourable member for Brampton South.
Madam Speaker, I'm grateful for the opportunity to speak in Sport Bill C-37, amend the Controlled Drugs and Substances Act, and to make related amendments or other acts. While I'm supporting this positive move, I must say that I'm still deeply troubled by this crisis that continues to hit communities. And on a personal note, I was deeply touched after hearing from those affected. As a member of the Standing Committee of Health, I, with my colleagues from all parties, studies this crisis. In fact, we choose to pass a motion to court undertake an emergency study of the crisis. We were all in lockstep with the minister, trying to make a positive difference and to make choices that would save lives. That motivation drove us to work hard and work together. We worked collectively and openly on this. That is something I'm quite proud of and something I have valued in my time as the MP of Brampton South and as a fellow parliamentarian of all who served together in this place. In committee, we heard from wide-ranging frontline perspective experts and from the Minister of Health directly on this. I would like to make particular note of the testimony the committee heard from Indigenous people on October 25th, which I feel was compelling, honest, and a real wake-up call about what we need to do to ensure we address the needs of Indigenous communities. For starters, improving access to naloxone treatment access, the life-saving medication used in the case of an opioid overdose, was needed for rural and remote First Nation in particular. That was a key part of the Minister's action plan coming out of the summit and goes to show what we can do when we consult all communities. In looking at the bill, I see that C-37 addresses that we heard from the Canada Border Services Agency about particular changes that help prevent drug-making material from entering the country. I applaud the Minister's work also to check suspicious international mail packages that are under 30 grams or less, which could be used to smuggle in any amount of substances that may cause harm. This is a good precaution to benefit Canadians. I want to remind colleagues that this bill is the product of hundreds of voices coming together. Our committee members were graciously invited to join in the Health Ministers' Summit on this as well. Coming out of the summit, we saw action. In fact, the joint statement of action by 42 organizations to address the opioid crisis was a broad but concrete approach that includes all those involved, from healthcare providers to first responders, to educators, to researchers and families as well. I want to applaud our Minister of Health and Ontario's Minister of Health as well for leading the conference, focused on concrete steps and delivering clear results. Our government has taken action from day one, building on our 5-point action plan to address opioid misuse. We have taken concrete steps, such as granting Section 56 exemption for the Dr. Peters Center and extending the exemption for Insight for an additional 4 years. We made the overdose antidote naloxone more widely available in Canada. Our government has recently approved 3 safe consumption sites in Montreal that the community asked for. Further, at the local level, we have seen action already undertaken. In the City of Toronto, the Mayor met with the Mayor of Vancouver and other officials in order to plan a proactive, not reactive response for Ontario as the crisis drifts eastward. The Mayor of Hamilton also held a discussion about this as well, and other municipalities have been doing the same. I hope more municipalities will reach out, learn from one another, and take proactive measures in their communities. The numbers and the experts support this as the right way to public health, and it also delivers cost saving. I see how various aspects of this bill address a lot of the concerns we heard at committee and at the opioid summit. While many members have made note of the urgency of passing this bill, I think the majority of members showed time and time again in recent weeks that they were willing to collaborate to move quickly on this. Yet, I want to reassure members that I believe this bill is in extremely collaborative, and well-thought-out bill that responds to experts in the field as well as frontline needs. It gives me comfort to know that this bill will make a difference, as others have said before. And I agree, we are in a national public health crisis in Canada. In 2016, thousands of Canadians tragically died of accidental opioid overdoses, and more will die this year. All governments and their partners must work together aggressively to save lives. If you have friends or neighbors who are hearing the Conservatives' argument that facilities like Insights are the wrong approach, I would encourage them to contact me or other members on the Health Committee who would be happy to provide nonpartisan, evidence-based information or why that does not reflect the safe consumption side model we see working already in Canada. All members of this House can agree that our hearts go out to every family and friends affected personally on this when their loved one lost their life, instead of having another chance. Last year in British Columbia alone, more than 900 people died from a drug overdose, an 80% increase from 2015. This legislation simply proposes to ease the burden on communities that wish to open a supervised consumption site while putting stronger measures in place to stop the flow to illicit drugs and strengthening the system in place for licensed controlled substances facilities. Experts and stakeholders told the previous government and then told our government that C2, as it stood, was not helping this crisis. That is why we took action to reverse the barriers that were holding back communities that have long been asking for the ability to save their citizens' lives. We know there's more to be done. As we move forward, we know the situation is sadly getting worse. The deaths from overdoses will now be greater than deaths caused by car accidents. This tragic crisis continues to move eastward in Canada, with increasing drug seizures of fentanyl and carfentanil across the country, and we will continue to work with our partners across the country to continue bringing forward evidence-based solutions to save lives that ensure that 2017 is the year that marks a turn on this national public health crisis. Many in Brampton South have come to me asking about my work on the Health Committee, and I over and over mentioned that we all agreed we should turn on focus this study due to the emergency at hand. They asked me why, and they are always engaged when hearing about how we can work together at committee to address real problems and issues that our fellow Canadians face. Again, the way our committee worked together is one of the cherished moments I have of being an MP, and I hope we get more chances to work collaboratively together again. This crisis called on us as leaders in our communities and as parliamentarians to take action. In October of 2016, I put forward a motion that the Health Committee call upon the Minister's Health to move as quickly as possible to conduct a review of the laws and regulations in place with regard of safe injection sites. And I suggested that the review have an end goal to improve the health and safety of Canadians using a strong evidence-based approach. With the passing of C-37, I feel the Minister and Government have responded fully to this motion that the Health Committee passed in October of last year. I'm proud to be supporting this legislation that saved the lives of Canadians who need our help. Thank you, Madam Speaker.
Questions?